All right, so I'm going to be performing a urinary catheterization for both a female and male patient today. So I'm going to be walking through the steps of this skill. Okay, so before I even go into the room, I need to make sure that I have a physician order to perform the urinary catheterization. Supplies I need to gather are going to be my Foley catheter tray. I'm going to go through the video and explain to you what's going to be in this tray as well. As well as the kit does come with a set of sterile gloves, but typically my hands don't fit those, so I went ahead and grabbed my own size of sterile gloves to take in with me. Okay, so I'm going to walk into the room. I'm going to perform hand hygiene. Knock, knock. Good morning, Mrs. Stein. My name is Tyler, and I'm going to be your nurse today. I'm going to first check with you and see what your name and date of birth is. Can you please tell me your full name? Okay, and your date of birth, 1/1/1980. Perfect. Mrs. Stein, before we get started, I also want to verify with you if you have any allergies, specifically to iodine or chlorhexidine. No? Okay, great. If they did have allergies, we would want to stop the procedure and go call the provider and let them know. Okay, but we're going to pretend Mrs. Stein does not have any allergies to iodine or chlorhexidine. So, Mrs. Stein, I'm going to explain to you. I performed my wipers. I introduced myself, identified you, and I'm providing for privacy. Pulled the curtain. I'm going to explain to you the procedure for today. What I'm going to be doing today is I'm going to be performing a urinary catheterization. If you don't know what that is a tube that I'm going to be inserting into your urethra to go right into your bladder to make sure that not too much urine is being retained in your bladder. Okay, does that sound all right with you? Okay, it shouldn't be a painful process. It might be uncomfortable, but at any time you feel uncomfortable or need me to pause, just go ahead and let me know. All right, so I explained the procedure. I raised the bed to a working height, and I provided for safety with having both side rails up. Okay, so I performed hand hygiene. I'm going to go ahead and put some gloves on. I want to make sure that my surface that I'm going to be putting my tray and supplies on is clean before I set those on there. Okay. All right, so wiping my surface. I want to make sure I allow that to dry per the manufacturer's guidance of these wipes. Okay. Take off my gloves. Hand hygiene. And we'll go ahead and pretend that that time has passed and I'm ready to go ahead and set up. Okay, so what I want to do before I even get my tray out and about is sometimes patients will have been incontinent when you're about to start the procedure. So I want to make sure that I have all the supplies I need to perform perineal care for my patient. Okay, so I'm going to put on my gloves. Mrs. Stein, I'm going to go ahead and check. I just want to make sure that you're not incontinent of anything. So I'm just going to gently pull up your gown, making sure that I'm checking all around, checking for any abnormalities, anything that would prevent me from being able to do the procedure today. Okay, if I needed to perform perineal care, I could do that with warm soap and water and a rag or bath wipes. Okay, so I would go ahead and clean up, take off my gloves, perform hand hygiene, and put more gloves on. Okay. All right. So, Mrs. Stein, I'm going to go ahead and I'm going to have you flex your knees up just like this. I want to make sure that I have enough area to perform the procedure. Okay. So I'm just making sure that the legs are in a frog-like position. Okay. All right. Getting my supplies, putting them on my table. I'm going to rip open my bag, take out my tray, throw it in my paper. The biggest thing is when you get your sterile field set up, you never want to turn your back on it, okay? So with your box, there's a little tab that's poking out when you first take it out of it. What you want to do with that tab is have that open away from you. You want to open your sterile field away from yourself. Okay, so making sure I give myself room, open straight across, okay? As you can see, there is a blue pad that is on top of here. What I'm going to do with that pad is open it and I'm going to lay it directly below the patient with the shiny side down. I have a 1-inch margin on that sheet. This is going to be my sterile field down here by the patient, okay? But I want to make sure that I'm not touching with my non-sterile gloves in the middle of that. I don't need to smooth it out, okay? So I'm continuing to open my my sterile field, okay? You'll notice also in this pack, this is where your sterile gloves will first appear. If you do not use these, you can go ahead and toss in your trash can below. Okay, so I'm going to go ahead, perform hand hygiene again, continue on opening my sterile field. Now you'll notice with these trays, sometimes they bounce back. Okay, what you can do is kind of pull it taut, make a crease to help that stay in line, okay? What I need to do is I need to make room for me to be able to open up my sterile gloves, okay? If you need a refresher on how to perform sterile glove application, you can go ahead and visit our other videos in infection control, okay? Opening that up, making sure I'm not breaking my sterile field. I'm not contaminating my sterile field that's over here as well. So I'm going to start with my dominant hand, lift, step back. Okay, you'll see that that messed up. That's okay. Just going to take my other one, that up, and commit. Okay, I'm not worried about the cuff. I don't care about that part. I just want to make sure that my fingers are in the glove properly. Okay, all right. So I don't need this sterile field, so I'm going to go ahead and shove that off. Okay, now my hands are sterile. I cannot touch anywhere that is not within this, because if I did, that would make me not sterile anymore. Okay, so what I can do is, since I'm sterile, is I can move this whole pack closer to the patient just to have it closer. Okay, if you open the first thing that is on your tray, you're going to see this fenestrated drape. What this is to help prepare the area around you, or where the insertion site is going to be for the catheter. So I'm going to lay that down across. Okay, I was able to flatten it out a little bit because it is technically sterile. Okay, you'll notice that this has given me a much more limited room to be able to work with, which is great when you're having maintaining sterility. Okay, next thing I want to talk to you about is going to be these iodine strips. Typically, there's going to be 3 swabs in here, and I'll show you exactly how to perform cleaning on a female patient as well as a male patient. Okay. Next up is going to be our lubricant. This is going to be utilized to lubricate the catheter tube to make sure it goes through more easily and less painful for the patient. Okay. This syringe is going to be our saline that we are going to inject into the hub that will inflate the catheter balloon. And so I will show you how to properly do that here in just a minute. Okay. I'm going to lift this tray up just so I have access to inside here. Okay. Inside of the container, you're going to see a specimen container that we can utilize to get a urine sample once we have the catheter inserted. So if I didn't need this, I could just set it to the side. If I'm setting it to the side, I want to make sure that I have my hands are sanitary, sterile, sorry. So I want to make sure I'm not touching the table. Okay. Take the cap out, put it there as well. All right. So just for educational purposes, I'm going to take this thing out completely. You don't have to do that when you're doing your check off. But what I want to show you is this urinary catheter is what it's going to look like inside the packaging. You have your catheter bag as well as your catheter tube. Okay. It has a clamp in there as well as the hub to fill the catheter balloon. Okay. So how it's going to come already pre-made is going to be in this box. This is going to be a way you figure out what works best for you. I'm going to show you what works best for me, and we can work out another way if that's not working for you in checkoffs. Okay? All right. With this, you want to make sure when you take the covering of this catheter off, you want to make sure that you're not letting the catheter dangle and hit outside the line of sterility. Because if it hits anywhere, if it hits the patient's leg, you broke sterile field and you need to catch that. If you don't, that would be an automatic fail. If it touches the outer 1-inch margin of the pad, that's breaking sterility. Okay? So when you're taking this out, you want to make sure that you're going slow and maintaining sterility. So before I take my cover off of that, I want to make sure that I provide or go ahead and preemptively get my stuff ready. So with my povidone iodine swabs, I want to go ahead and open those, and you want to be careful because they do spray out sometimes and can cause a lot of mess. Now, if you have a trash can here, you want to make sure that you're not dropping your hand below your waist because that breaks sterile field. Whereas I'm just going to lay it right on this pad right here. Okay. I'm going to take out my swabs and I'm going to lay them in the tray just like this so I have them ready to go. Okay. I'm going to lay my povidone iodine swab container and lay it down, opening my lubricant. Okay. And I'm going to put that in this tray right here so I can dip the catheter tubing in there. You want to make sure that you're lubricating that at least 2 to 4 inches to help ease it in there for the patient's comfort. Okay, taking my saline, and I'm going to go ahead and lift my tray and get all of this ready for my patient. Okay, so like I said earlier, you want to make sure that when you're taking this cover off, you're not just letting the catheter dangle and hit somewhere that is not sterile. Okay, so what I do instead is I take it out and I start to wrap it in my fingers. Okay, this helps maintain control of it. I'm just going to throw that over here. We can deal with that later. Okay, so I'm taking my catheter. I'm going to go ahead, take my saline syringe, and I'm going to connect it to the hub. Okay, this, when I inflate it, is going to inflate the balloon to where it's going to act as an anchor to help it stay in the bladder. We never inflate this before we insert it into the patient because once we do that, we ruin its smaller size. And so the more you inflate it, the bigger it becomes, the more uncomfortable it can become when you're inserting it into the patient. Okay. So just imagine it being a balloon about this size when you inflate it with all 10 mils of the saline. Okay. So what I'm going to do is I'm going to go ahead. I'm going to lubricate the catheter at least 2 to 4 inches.